Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. Today, I'm going to tell you about a case whom I have been following up for the last 5 to 6 years. He is a gentleman who was 50 years when he first came to me and he resides in Kuwait. His main complaint was that he had acidity, he had regurgitation of food, heartburn on and off, and it had become more frequent when he had come to meet me at that point of time. He was staying alone and his family was in India. He used to have food at erratic time. One thing that he was very much worried about was his family history of cancer. He also had heart disease. So when he was 48, he had chest pain for which he was admitted and he was given treatment. So every time when he got this heartburn, he was very much worried. So I explained him after doing a battery of tests that this is a common condition called as GERD, Gastroesophageal Reflux Disease. And I explained to him the lifestyle changes that were needed. He tried, he was on medication for some time, and it did not give a complete cure. So he underwent surgery. GARD, a lot of things you all know about it, that it is acidity and it can cause a bit of burping, etc. But there are a lot of things that you do not know about it, and today in this video, I'm going to talk about that. So, what exactly is GERD? Gastroesophageal reflux disease is basically a condition where we have the gastric content, that is the acids, refluxing. Refluxing means going back up into your food pipe, where from the stomach it goes to the food pipe in the amount which is more than what is required. So this is what causes symptoms. So what are the common symptoms that you can present with? You can present with a heartburn or regurgitation of food, which comes as a burp in some cases, or some people say that I have this metallic taste, I have this acid taste, I have this taste of the food that I had taken the previous day. These you all know. But do you know that you can also have cough? That is because it is touching your windpipe, it is touching your throat. Some people will even have wheezing when it goes into their respiratory tract. It can even cause ear infection because your throat, your ears, and your nose are interconnected. So you can have it as nasal discharge. That's why when we vomit, some amount of food particle comes through our nose. So they might have ear infection, they might have nasal infection as well because of GERD. Apart from this, when you have recurrent for a long time, this reflux, then you can have dental caries. Your enamel can undergo erosion. These are the symptoms that usually you all present to us with. So we explain you the most important thing, that is lifestyle changes. So how do we diagnose and start with your lifestyle changes? We go for upper GI endoscopy. Depending on the level of erosion, depending on your reflux that you have, depending on how lax your esophageal sphincter is, if you have an hiatus hernia, these are certain clinical criteria that as doctors we look at before we suggest. But there are certain common things that you all can do. What is it? But number one, having short, frequent meals. Do not take your meal up to the brim. Like basically, it's like filling water up to the end. Similarly, your stomach is like a bag. Do not dump it. Do not eat full stomach. Always eat only 3/4 or 80% of your stomach. And why did I say short, frequent? Every 2-3 hours once, when you're having your food, the acid gets neutralized. And when you're taking low amount or when you're not having a full stomach, it does not go back up. So thereby the symptom reduces. Second thing, when you're going to bed, make sure that your meal is completed at least 3 hours prior to it. Late dinner will definitely cause regurgitation of food. Third is your obesity control, especially your abdomen fat. In general, you have to maintain your weight in normal range and make sure that you don't have too much of abdomen obesity. You can correct this with physical measures like exercise, or you can go for your diet, and whatever method you're using, make sure that you're maintaining your weight in the normal range. The fourth point is when you lie down, your bed posture, that is your pillows, how much you're keeping, how high is your head matters. See through that it is at least 8 inches when you lie down. This way, you're maintaining an angle so the food is not coming back to the esophagus, that is your food pipe. These are simple measures, and there are certain things that we have to avoid. That is the fifth point. What all should you avoid? Whether it is a citric food or it is a chocolate, or let's say it is a caffeine based, coffee, tea, anything that triggers your acidity or reflux, you will have to avoid these things. Go for a low spicy, low fat diet as much as possible as well. Sixth, last but not the least, is of course the junk food. More the junk food in your diet, more the risk of you developing GERD. Make sure you're avoiding all these things. When we come to medical management, that is the treatment that we give as doctors. We have various options: H2 receptor blockers, proton pump inhibitors, we have potassium competitive acid blockers, and we also have antacids. We do have prokinetics. All these things will help you. But remember, it is not going to give you a permanent cure. People who want permanent cure, or people who are above a certain age, like a postmenopausal woman, or who has osteoporosis, if there is someone who is not compliant with the treatment that we are giving them, or someone who is not tolerating it, who is not able to follow, or is forgetful due to whatever medical conditions that they have, all these people would require surgery, and this surgery is called as fundoplication, which would be done by various methods. See, majority of this can be prevented and corrected with lifestyle changes itself. Only in situations where it is not at all controlled by lifestyle changes, medications, would you require a surgery. So as much as possible, let's try to control it with our lifestyle changes itself. I'll be meeting you all with more such informative videos.